Now we are here today because of attending to health matters of our people. This is our level 5 referral hospital in Tharaka, the highest level of referral in the county. It has come to our notice that of late, in the last few months, our people in Tharaka, I'm talking about patients, have been going through hardship that is instigated by our mismanagement of HR issues. That personnel who are supposed to take care of our patients, and I'm talking about personnel from all levels, some of them, not all of them. We have some very good ones, and we have some who are participating in this very unprofessional, very uncouth behavior and treatment to our patients. We have in all the cadres, including nurses, clinic officers, MOs, or what we call medical officers, and the ones we call specialists. Those who are using our hospital as a platform to poach patients to their private clinics. These patients come to our hospitals because they believe in the public hospitals because of the investment governments have put in ensuring that we have good labs to make sure that we diagnose the disease. We have good theaters. I have gone around and seen state-of-the-art theaters. In fact, Chuka Hospital has 3 theaters, all of them state-of-the-art, modern, latest technology. The X-rays and ultrasound, all of them are digital and new. We have the latest, the most sophisticated CT scan here in the hospital, courtesy of the new system that we have in collaboration with the national government for having placement model of the CT scan and other equipment. The CT scan we have in Chuka Hospital is the one that takes a resolution that has got 128 slices, meaning it has very good exposure. It is the best in this region, leave alone the county. But patients are still leaving a hospital and going to clinics and outfits that are behind shops, especially in Chuka town and Marimanti and a few parts of Mara constituency. And we are saying this behavior must stop. Because what we have realized is our own people who are entrusted with our patients. The same people, professional, who are being paid with taxpayers' money. And they have taken this job because this job pays well here in the public sector, are the same people who are referring our patients to their clinics with the excuse that there is no medicine. They leave the medicine here. They leave the labs that are very well equipped here, and they refer them to their clinics. And as a result, our people have really suffered. Some of them are paying twice because for you to see them here, you must pay for consultation. When you go to their clinics, you also have to pay for their consultation again. And sometimes because the level of professionalism is not controlled in where they're sending them, sometimes they stay longer in those referrals because of reasons that are best known to those people who refer to them there, because the longer you stay, the more you pay. While here we're interested in solving problems of patients so that they can leave space for others, there are places where you go and you're kept for long so that people can claim more share. I have told Dr. Nduraku and his team, I've met them this morning, and I've told them our health workers have to make a choice between working for Tharaka County and working for themselves. The contract that we've given them, some are permanent and pensionable, others are on contracts. If you look at their pay slip, it has an item we call non-practicing allowance, which is an allowance they are paid so that they can forego their practice during the normal working hours of our patients or the people of our hospitals. That leaves them with the ability to be able to do those practices over the weekend and public holidays in the hospitals. But it has become so uncontrolled and so bad that they spend only an eighth of their time here in the hospitals, and the rest of the time, which is 7 over 8, is spent in their private practice. Yet you're paid non-practicing allowance. We even pay strenuous allowance. And when a doctor is on call, they are also paid emergency allowance for coming to attend to our patients. So our hospitals have almost become ghosts because of this referral system. And I want to tell the people who are listening to me of Tharaka Nithi, we are putting measures in place, and I want a system put in place so that our people know where to complain. If a doctor refers you to their clinic and you go and find out that the same doctor was seeing you here, sent you there, within confidentiality, you need to report that doctor. We will not disclose your identity because that doctor is exploiting you. You leave good theater here, they take you to a backroom theater. You leave a good lab here, they take you to a backroom lab or theater. You leave a good machines here like the CT scan and the X-ray, which is digital, they take you to a backroom. And then sometimes because they're not able to have good diagnosis, they send you back here and then you take the results back to them. Anybody, any patient who is sent here by the same doctor who had seen them here in their private clinic, when they come back here, they should be able to report so that you can be able to assist them. But the problem is not even our patients, because they are so scared of these doctors that some of them, when you ask them questions, they become timid and hide. Like today morning, I had a patient who was mistreated. He was sent by a surgeon to a hospital in Embu, a private hospital. When he came back to see the same doctor here, the same doctor hit a corner. That patient came to complain, but when we looked for him a few minutes ago, he switched off his phone because he's fearing the doctor.